Today, actually, I'm going to discuss a very important topic regarding how to choose or what to choose between kidney transplantation and dialysis. Why this question arises? When somebody develops end-stage kidney failure, that means he is having severe kidney failure. Severe kidney failure means if his kidney function is less than 15% of the normal. The normal actually we express as GFR, glomerular filtration rate. Normal is 100 to 125 ml per minute. If goes below 15 ml per minute, then we say it severe kidney failure. And by that time, actually, you have to plan for whether the patient has to go for a dialysis or transplantation. But in India, actually, we start dialysis once the patient is symptomatic or patient usually goes, his kidney function goes below 8 ml per minute GFR. So what is the symptoms when somebody has to think of? Usually the early symptoms are loss of appetite, patient will not feel hungry, then there'll be weakness, there'll be itching, there may be somnolence, patient may be sleeping more in daytime than the nighttime. So that the alteration in the sleep cycle. So these are the early symptoms, or there may be nausea and vomiting, patient always nauseating, not interested to eat. So these are the early symptoms when one should plan for either for a dialysis or transplantation. The next question is why these things happens, because once there is a decrease in the kidney function, the body cannot maintain the fluids, the blood pressure, the sodium, potassium, the urea creatinine, the other chemicals like calcium phosphate, uric acid, which are mostly balanced by the kidney. So when these toxins are accumulated in the body, that create problems. So somebody has to do the work of the kidney. Somebody means either it has to be a machine that is dialysis, or you have to replace the damaged kidney with a new kidney that is known as transplantation. So it is sometimes very difficult to decide to go for what, whether to go for a dialysis treatment or go for a transplantation. So the thing that both has some advantage and disadvantage, and you have to decide as per your accessibility of the medical facilities, your circumstances, your age, your paying capabilities, because both the modalities of treatment requires a lot of money and also time. So I will go dialysis and transplantation. So when who are the fit person for transplantation? Actually, anybody with a good health, particularly the younger people. In India, actually, maybe they're less than 65 to younger, all the children also, they are undergoing transplantation. So what is a transplantation? Transplantation means we take a kidney from either a cadaver, that is brain dead person, or from a living, either it is a related or unrelated. So in India, only law permits it is the related. Related means father, mother, brother, sister, wife, husband, and grandmother, grandfather. And other people who are allowed are the emotional related, like friends, close friends, like that. But that has to be the permission has to be given by the committee of the respective state. Then they can be transplanted. So what is the advantage of transplantation? What I have seen over last 25 years of my transplantation practice, the most important thing is that the quality of life. Actually, you see why you treat somebody. It is because to improve the quality of life. So with kidney transplantation, there is good quality of life. He can perform his duty. He can have a normal, relatively normal life, and he can enjoy his life. He can go. He can do his duty. You can go for travel. So it is the quality of life will be much better if you compare with the hemodialysis that I'll describe later on. But and another important thing, what is the disadvantage of this kidney transplant? Disadvantage is that actually need a kidney for the transplantation. It is not easy to get. It is very difficult to get. Nowadays, if somebody is diabetic, then entire family is diabetic. or nowadays because of the smaller and smaller family, so there are very few people in the family to donate kidney. To get outside kidney, it is very difficult. The law does not permit it. So that is one of the biggest thing, the availability of the kidneys for the transplantation. Second thing, that it needs at a time, initially it needs a lot of money. Later on, the cost goes down, but initially it costs a lot of money, because to go to in private sector, the cost varies from the 10 lakhs to 15 lakhs, maybe more. And if somebody is lucky to do it in government hospital, it may be cheaper, maybe it may be free in the government sector. So one of the cost is very important thing. And another thing, that patient has to continue medicine lifelong. He cannot stop medicine. He has to continue the kidney transplant medication, not to reject the kidney. So other things in India, actually what we see, that patient may have a lot of infection. Always he is very careful, because even if in India the normal person gets infected, there is diarrhea, cholera, many things are there, tuberculosis, and many problems are there. So it is difficult to prevent infection. So they have to be very careful for not to have infection. And next thing is that hemodialysis. Definitely hemodialysis is the next. There are two types of dialysis: hemodialysis and peritoneal dialysis. Hemodialysis means you have to clear, or you have to purify the blood by a machine. That is a dialysis machine, and the patient has to go to the hospital 2 to 3 times in a week, and the standard dialysis 4 hours, and it is 2 to 3 times in a week. And the advantage is that now the dialysis facilities are now started to have available, at least in the district level. Even some rural also it is not available, and widely now available. And the problem is that the dialysis cannot cure or correct all the problems of kidney failure. But in case of transplantation, the kidney which are giving to the patient can perform all the function of a normal kidney. All the function means blood pressure control, blood formation, blood purification, control of the sodium, potassium, blood, everything can be done by the transplantation. But in dialysis, only we can remove the urea creatinine and control the pH, also control the blood volume, but not all the functions like blood formation function. So it is one of the disadvantages of. And another disadvantage of hemodialysis is you have to go 8 to 12 times in a week, and somebody has to accompany you. So the cost of therapy goes up, and it is a continuous therapy, because continuous therapy means lifelong. Unless you get transplanted, you have to continue it. And if you see the cost, long-term cost, it is much more higher. In average private center, the cost of per month is around 30 to 40,000. That means around 5 lakhs per year. In comparison, once if you can do transplantation, that cost goes drastically. It may be 1 lakh or 1.5 lakhs in a year after 1 year of transplantation. So cost-wise, hemodialysis is costlier. If you are lucky enough, then you can have free dialysis in government centers. Dialysis process is the peritoneal dialysis. So what is a peritoneal dialysis? We put a catheter in the abdomen of the patient, and the abdomen, the peritoneum works as your semi-pulmonary membrane where dialysis occurs. And the advantage of peritoneal dialysis is that you can do at home at your pace, and but it has to be done every day, and 3 to 4 times in a day. There are also automatic varieties available, that is known as APD, that can be done at night, so that you are free in the daytime. But peritoneal dialysis is a slower process, and the major problem can happen to peritoneal dialysis, infection. But nowadays that infection rate has come down like anything, because of the newer techniques and newer bags for dialysis are available. To summarize my talk today, for a end-stage kidney failure patient whose numbers are increasing day by day everywhere in the world, now 10% of the population are having chronic kidney disease, and many of them will end up in end-stage kidney failure. and they will require either dialysis or transplantation, and they have to decide transplantation or hemodialysis. If I will advise all the younger people to have kidney transplantation, because the quality of life, the cost of therapy, long-term cost of therapy will be much better with your kidney transplantation than hemodialysis. If it is not available, not possible for due to any unavoidable reason, because of non-availability of donor or infrastructure, whatever it may be, then hemodialysis is for you. And peritoneal dialysis for the people who are, particularly those very elderly people with multiple problems like heart problem or other liver problems, they can opt for this. And if same thing like hemodialysis, if you are not able to do transplant, then go for peritoneal dialysis. And the cost of peritoneal dialysis is almost equivalent to hemodialysis, or maybe a little bit more than that. And you can avail. It is now available throughout India. And another advantage is that you can do it in your remote place, any remote place in India, whether you are in the hills, whether you are in the any small island or anywhere. So you can do the peritoneal dialysis anywhere where there is no doctor, there is no hospitals there. You can do it. So the remote, I think, as of now, the peritoneal dialysis is most suited for people who cannot travel for a long distance to hospital, cannot do transplant, and staying in a place which is far away from the your main hospital centers or cities.